This is a great opportunity to have people from different parts of the world with different responsibilities and mandate to discuss how this particular meeting, but how especially the new global agenda can help us to get violence against children in its different forms more highlighted in the global agenda, and also how we as a scientific community, practitioners, policymakers can accelerate the process of reaching the goals. And each of you here have, as I already said, very different mandates, but play really a crucial role for different constituencies. And I think what I would like to do, because none of you has been giving any keynotes, that perhaps you could introduce yourself and say what you are doing currently and what you see your role in this particular new global opportunity with the 2030 agenda. Andrew.
Thank you, Joanne, and thanks to Mount Sinai and the World Childhood Foundation for inviting me to sit on this panel. I've got a few prepared remarks which I think I'll read, and then it'll give some structure to the panel discussion. And I wanted to begin well, first of all, my name is Andrew Claypole. I'm a senior advisor in the office of the Special Representative of the Secretary General, the United Nations Secretary General on Violence Against Children. And I wanted to begin by noting that for us in the global intergovernmental system, the path to end violence against children, I think, really started with the adoption of the Convention on the Rights of the Child in 1989. This was the first time with the convention that in international law we had an explicit prohibition against violence against children, requiring all states to act upon it. The convention, as many of you may know, is the most widely ratified international human rights treaty, and it puts on states parties particular responsibilities to take concerted action to address violence against children. And they're also required, states, to make a regular monitoring report to the Committee on the Rights of the Child, which is housed in Geneva, about how they're addressing the challenges that there are in realizing the right of every child to protection. Building on the work of the implementation of the convention, in 2006, the United Nations did a global study to take stock of the nature and scale of violence against children around the world, while trying to identify what was known at that point of the most effective policies and programs to prevent and respond to it. The UN study on violence against children, it looked at violence in the home, in the community, in schools, in the workplace, and in institutions for the care and protection of children, including in the criminal justice system. And the study came out with a long set of but very clear recommendations for action by member states, and these were unanimously adopted by the General Assembly. One of these recommendations and one of the follow-ups was that the General Assembly urged the appointment of a special representative of the Secretary General to monitor this global situation, to advocate for the study's recommendations implementation, and to draw attention to new and emerging forms of violence against children. And as I mentioned, it's my privilege to work for the current SRSG, Ms. Marta Santos Pais. The work of our office focuses really on three major areas emerging from the study, and that's to ensure that every country has in place a comprehensive ban on all forms of violence against children in legislation, that every country has a national plan or strategy to work on prevention and response, and to promote research and data generation at the national and global level on the scale and nature of violence and the best ways to tackle it. And I think we heard some really very interesting work in the previous panel, which again needs to be much more widely known. I think since the study in 2006, there's been much has been achieved. Starting with Sweden, we have two Swedes on the panel. In 1979, we now have 50 countries around the world which have a comprehensive ban on all forms of violence against children, including the use of violence in discipline. in schools and at home. And 90% of countries around the world have legislation in place for the prevention of the sexual abuse and exploitation of children. More than 90 countries have a comprehensive national agenda or national plan to address and respond to violence against children. And a few examples I could give you is that Cambodia just last year launched a 4-year action plan to address and respond to violence against children. France has adopted a new interministerial plan of action to combat violence against children. Malaysia has strengthened its legal framework to prevent sexual abuse and exploitation through a new sexual offences against children bill. And in Uganda, just last year, they have developed a national strategy for preventing violence against children based on a very solid piece of research, a national survey on the scale and nature of violence against children. And as we heard in the previous panel, we have more data and research, and I would point to for example, there are now 22 countries around the world which have either conducted or in the process of conducting nationally representative household surveys to look at the extent and nature of violence against children. These are surveys which are specifically about and only about violence against children. So I think these are really quite significant achievements, but as we know, there's still a great deal to do. And these examples which I've given are making a real difference in children's lives, but they're also, in a way, contributing to the global implementation of the 2030 Agenda for Sustainable Development. The International Development Agenda, the Sustainable Development Agenda, now has within it a specific target, 16.2, which calls for the end of all forms of violence against children by 2030. But of course, the challenge is to translate this international goal, this Sustainable Development Goal, into reality, guided within a framework of the Convention on the Rights of the Child. And just finally, I want to mention how it is in the United Nations that we monitor progress on towards the achievement of the Sustainable Development Goals in the agenda. There is a mechanism called the High-Level Political Forum, and this is a crucial opportunity for the international community to both celebrate the achievements and as we're moving forward to reaching the SDGs, but also to highlight where there are shortfalls and galvanize action. This is held at the United Nations every year in July. Next year will be a particularly important point and an important milestone for two reasons I'd like to point out. One is that this is the first time in the SDG process where SDG 16, which includes Target 16.2 on ending all forms of violence against children, will have a systematic review. It's also, 2019, the 30th anniversary of the UN Convention on the Rights of the Child. And I think the co-occurrence of the anniversary with this specific review of this aspect of the Convention on ending violence against children is a great opportunity. And we, in the UN and in the Office of the SRSG, are now mobilizing globally to ensure that all countries do report on how far they've come in addressing violence against children and where they think more effort is needed. So those were just a few introductory remarks, and then I look forward to the discussion.
Perhaps just the question, a more explanatory question. What is the difference between having a convention, which is a more legally binding document or tool to monitor violence against children, and having a sustainable development goal with a specific target, and perhaps you could also mention specific indicators. A lot of our discussions here are addressing the challenge of the prevalence of child sexual abuse and neglect, and it would be interesting to hear how those particular aspects are being covered and what are the differences.
Well, the convention is, for states parties, is a legally binding instrument, and it means that when you, and as I have said, all but one country has ratified the Convention on the Rights of the Child. It is the most widely ratified convention. It puts obligations on states to do the best that they can within the resources that they have to address all of the articles in the Convention. And it was unique, well, it was not unique, but it was a breakthrough, the adoption of the Convention, in that this was the first time there was an explicit article saying that states must do their utmost to bring an end to violence against children and to have an adequate response. There are a number of things which follow from it. As I mentioned, there are reporting requirements. Every state is required periodically to make a report to the Committee on the Rights of the Child. It's also a process. Civil society, academia is involved in those reporting processes to the committee to point out where there are perhaps gaps in the report that the state party may be making. And then the Committee on the Rights of the Child will come out with a set of recommendations for action by the states party. The Sustainable Development Agenda doesn't have that force. It's not a legally binding instrument. The global community has come together and through a long process in the development of the agenda and the goals, agreed that these are the priorities for the next, was for 15 years when it was launched, and we will work together and we will work collectively, because one of the key elements of, I think, the new Sustainable Development Agenda, which was not perhaps so explicit with the Millennium Development Goals, is that we recognize the complexity of the issues and the interrelatedness of all of the issues that we deal with in international development, but also that we can only make progress through partnership. It's not just the responsibility of states, it's the responsibility of everybody to work together and also, most importantly perhaps, to leave no one behind. And in the particular case of the work we do, leave no child behind when we're addressing issues of violence against children. There are, as I said, the political reporting processes, which happens through this high-level political forum, but there's also a data process which is led by the UN Statistical Commission, in which a set of indicators, 169 indicators across the whole of the agenda have been developed, and states are encouraged to report where they have the data, and if they don't have the data, to find ways of getting the data to report on these indicators. And 16.2 has 3 indicators related to violence against children, sexual violence, physical violence, emotional violence. This was mentioned in the panel just now. It's a very important but often neglected aspect of violence against children, the impact, both short and long term, of emotional violence on children. It's clear that there's a lot of data gaps, but there's a lot of work being done to try to build the capacity at national level to be able to report on the whole of the agenda and on 16.2 in particular.
Well, and you have a big job, because it's really the responsibility of the Secretary General, and which has been delegated in a way to Marta Santos Pais, that the Convention of the Child, of the Right of the Child gets implemented. And you have been doing phenomenal work, and Marta has been an incredible champion for children. And I know that both the Swedish government, but especially our founder, Queen Sylvia of Sweden, has been always very supportive of this work, and the foundation's work is actually originally based on the different articles from the UN Convention of the Right of the Child. You mentioned a very important statement, which is like a leading mantra almost of the Sustainable Development Goals, leaving no one behind. That sustainable development really encompasses economic development, environmental sustainability, and social inclusion. And I think leaving no one behind has become a responsibility in a way of one of my long-term colleagues who I happen to have worked with at Karolinska Institute, and who now is much more involved globally than before, looking at the very large portion of children in the world, children with disabilities. Hans.
Yeah. So good afternoon, and thank you, Joanna, for inviting me, as I feel a bit of an outsider, because I'm not going to talk so much about violence against children. I'm going to talk more about children with disabilities. And I think you said, leave no one behind. That is so, and this is another group. A lot of same problems as you have with children who have been subjected to violence. And I want to give you some background, because I don't know how much you know, but most people, they are quite ignorant about the size of the problem. So I'm, as Jana said, I'm a pediatrician. I'm a child neurologist doing research and clinics up till a few years ago. So I'm not an expert neither in the global agenda, but this is what I have found. So this is the Millennium Goals, and they were very much directed to, for example, primary education, to reduce child mortality, improve maternal health, combat infections. So very concrete, and if you look on mortality, for example, extremely successful, almost halving the under five death. So what I see what's happening now with the move some years ago to the sustainable goals is we are moving from survival or survive to thrive. So it's not just children should survive, they should have a quality of life. And we have that in good health and well-being, quality education. And very much the UN organizations have worked in the concept called the ECD, Early Childhood Development. Are you all aware of the early childhood development, what it means and what is included? I was not actually, still I had been in the field until a couple of years ago. And mainly let's see now. Yep. So mainly there are 5 activities. It's improving health, it's secure nutrition, it's security and safety. And here actually we have the vulnerable children. We both have reduced violence, and we also have intervention for vulnerable children. For example, children with disability. And this is actually, when I, with my eyes, read through this, you never actually name children with disability. They are part of children who are vulnerable. And I will come back to it because I think that is very important. The theoretical framework was very much launched in a series of articles in The Lancet 1.5 years ago, called an Advancing Early Childhood Development from Science to Scale. And to make it extremely brief, one of the major findings here was that new estimates based on proxy measures, and then they were measuring stunting and poverty with different measurements, indicate that 250 million of children, i.e. 43% of children living in low or middle income countries, they are at risk not reaching their developmental potential. So that's a huge number again. And of course, as you see, the red, they are over 60%. So in particular in sub-Saharan Africa, in Afghanistan, there is a high risk then that children living there, it's 60%, that's more than half, are not reaching developmental goals. The green ones are between 40 to 60. So we have learned a lot today about how important it is the early child development for how the brain develops. And we have mainly actually heard how the environment is shaping the brain. We have not heard so much about the genes, and actually the whole brain is programmed by nobody knows how many genes. So that is really important that this program is functioning properly. And it's the interaction between the environment and the genes that form what we call the genotype. And the genotype, that is our functioning, our behavior. And as you know, there is an enormous variety of behaviors and functions. So we have heard, now I do it in a different way. I talk about prenatal, the birth, and the postnatal. So we know that there are many environmental factors that are very, very early now affecting how the brain, and shaping how the brain, modulating, you used in the panel. And you see it's intrauterine growth, and of course if your mother is stunted, already there you have a problem. it's infections, it's exposure to different chemicals, and we have heard a lot about stress. And you see, stress, it's both maternal stress and actually stress after birth. But what we have not talked so much about is the genes. And what we know is that there is a set of genes that have variant forms. We call them copy number variants and single polymorphism, who actually underlies now deviant development. The trajectory is not going the typical way. So we get what we call a neurodevelopmental disorder. And this slide, I think, not many are aware of, because if we start in the left and we look at different functions, motor functions, seeing, hearing, intelligence, communication, learning, and behavior, you see we have a series of different disorders. And if you look in the right column, what you see is the prevalence in high-income countries. So if you add all these numbers, you are actually coming to 20%. But that's not what you find. So in a population, or in a child, if you have one developmental disorder, it's more common to have 2 or even 3. So we say in high-income countries, about 1 in 10. If we now look in the low and middle-income countries, there are a variety of studies of very low quality, you could say. And the reports say, some say as low as 1%, and other up to 49%. And I don't think that you need to be a rock scientist to understand that this is something strange in this number. It cannot be such big. So the answer is we don't know. We don't know how common it is with disabilities in these countries. What we know is that about 10% of the world's population, that's based on estimates, but we know that 80% of them are in developing countries, that there is a very strong association with poverty, that most of them have no rehabilitation, no assistive devices, no education, and no. So here we have really a group which is marginalized, discriminated, and neglected. And this can be now, when we find now, one measure to see how these children are included in society is to see, are they going to school? And this just came the last week, actually, from the Global Partnership for Education, looking on inclusive education for children with disability. And again, you can see the prevalent estimates go from 0. Several countries have no child with a disability, and some have over 20. And when you look on inclusion, it's very, you have 0 who are not included, but if you do not measure children with disability, of course they cannot be included. So this is just showing that we do not have. And what they claim is we have lack of robust data, we have negative and discriminatory attitudes, lack of infrastructure both in health and education, and no collaboration. And I think what I've heard this morning is very much the same information coming. There is another twitch to this, and that is having a disability for a child, there is an increased risk to be abused. And I just found this review, it's now 5 years old, and where they could at that time find 17 research papers, 11 from USA, 6 from Western Europe. Again, nothing if you look on the global agenda. And they were studying then the prevalence of physical, sexual violence, emotional abuse, and neglect, very much what we have heard here. Now, I'm confused with all the numbers I've heard today, because they are so huge, so I have really hard to believe them. But here we have 1 of 4 had experienced any violence. Now it seems that it's more common even in the typical, or in the normal population. But what we could say, if you compare with control, is 3 to 4 times higher risk to be a victim of violence compared to if you know how have it. This is also interesting since we have been discussing this morning the brain. So we could say, is there a reverse causation? Namely, that having a disability is not a risk factor. You get disability because of abuse. And as you see, I have found now, Taichi, you had actually much better information this morning about this. But it has been shown that if you have, as a young child, been subjected to abuse, you have changes in several brain structures. It has also been shown that these brain structures are the one involved in executive function and in motor function. And these are symptoms we find at ADHD. And there are then some actually studies now showing that children who have been subjected to violence, they have higher risk to develop the ADHD phenotype. So I think this is going very much now in line with what we have heard this morning and this afternoon. So this is my last slide then. So what I think is that we have here a lot of commonalities, and we can actually share and learn and actually collaborate in this. So we have vulnerable children. They need special support, but they are often neglected, or you don't find them. There are no data actually from low and middle income countries. There is a negative and discriminatory attitude. You don't want to talk about this. They are hidden away. And we also saw now last year that there is an interaction. And what we lack, and what I learned a bit about from here, is the strategies now for early identification and intervention of these children. So that is my input, and I would be happy to answer questions later on. Thank you.
And my hidden agenda, which is perhaps not so hidden, it's becoming obvious, is that unless we have the community and the expertise in early childhood development working very closely with the experts in adolescent health and working very closely with people working on different forms of violence against children, we will not be successful. And these are the same children that are experiencing, we cannot talk about effective early childhood development programming without addressing the issue of violence that we know is so prevalent. We cannot talk about children with disability and early childhood development without thinking about the fact that they are at much higher risk of being abused. So we need a more comprehensive form of strategies to address this type of problems. I don't want to take too much time, so I would like to introduce Karol Smolensky, who has, I was trying to calculate, must be more than 31 years that you have spent working.
I'm old.
Are you? No, well, she started very early.
I was a child prodigy.
Yes, fighting commercial sexual exploitation of children.
Thanks.
And so please.
I'm Karol Smolensky. I'm the executive director of ECPAT USA, which is the US branch of an international organization that works to protect children from sexual exploitation. I'm going to be maybe breaking the mold here a little bit, talking about a very specific and detailed program that ECPAT has developed and has introduced around the world about protecting children from sexual exploitation in the context of travel and tourism. So I'm going to start out with a few statistics. In 2016, there were 1.235 billion international tourist arrivals. That's how many people crossed a border for travel purposes. In 2016, the travel industry generated $7.6 trillion, trillion with a T, and 292 million jobs. It represents 10% of global GDP, about 1 in 10 jobs in the global economy. And for the 6th consecutive year, growth in travel and tourism outpaced that of the global economy. I'm saying it is a huge and growing industry. And I start with those statistics in order to talk about the industry and to give you some background about the work we do to protect children against violence. Because despite 20 years of efforts, the sexual exploitation of children in travel and tourism has expanded across the globe and outpaced attempts to respond at both the international and national levels. The result of the first comprehensive global study on this phenomenon confirms that no region is untouched by this crime and no country is immune. In an increasingly interconnected world, more people are on the move, and even the most remote parts of the planet are now within reach thanks to cheaper travel and the spread of the internet. Also in 2016, ECPAT published the global study on sexual exploitation exploitation of children in travel and tourism, with 67 global study partners, including governments, the private sector, law enforcement, and NGOs. Expert papers were submitted in collaboration with many of these contributors, and regional reports were also produced. So much of our advocacy, as an organization that does a lot of work on policy, most of our advocacy has been aimed at government policies. But this demonstrates that we really actually have to start to pay attention to the private sector, which is something that we've been doing because they are in a position to protect children. So the global study had 37 recommendations for how to confront the phenomenon, 8 of them specifically aimed at the private sector. So we have, by building a thoughtful strategy and selectively partnering with industry leaders, actually had a lot of success in collaborating with them in helping our cause. So I want to tell you about that, how we have done it, what we've succeeded in doing so far, and how we still have to spread this. The Code of Conduct for the Protection of Children from Sexual Exploitation in Travel and Tourism, everything we do has a very long name. But we just call it the Code. It was created by ECPAT Sweden in 1998. The Code has grown quite rapidly around the world. There are 200 members now around the world. It is a series of 6 voluntary steps that companies can take to prevent sexual exploitation of children from happening on their watch. The 6 steps that they can voluntarily take are to establish a policy and procedures, a policy against sexual exploitation of children. When we first engaged with companies, it was amazing to me how many companies were resistant to having a policy. So they have to have a policy, they have to train their employees about what it looks like and what to do. They have to include a clause in contracts with suppliers with a common policy. They have to provide information to travelers, provide information to business partners, and then report once a year about how they have implemented this code. So it was introduced in North America in 2004 at a big event at UNICEF with Queen Sylvia of Sweden, UNICEF's executive director, US Ambassador John Miller, and other dignitaries. And one big US company, Carlson Company, signed the code, led by our, in many ways, fearless leader, Marilyn Carlson Nelson. Carlson Company is the company that owns Radisson Hotels and other hotel brands, and Carlson Wagonlit Travel. So since then, we've been promoting the code for US companies. And I have to say that after all of these years of work, I'm proud to say that most of the large international US hotel chains have signed the code. Marriott, Hilton, Wyndham, Choice, Hyatt, and of course our flagship, Carlson. These 6 companies represent 6 of the 10 largest hotel companies in the world. Thanks to the implementation of the code by these and other companies, we know that more than 50% of all the hotel properties in the United States have had training about human trafficking. There are 50,000 hotel properties in the United States. And some of the biggest companies are requiring training for every property under their umbrellas around the world, not just in the US. So for example, Hilton owns 13 brands. Some of which aren't called Hilton, but like Embassy Suites and DoubleTree. Marriott owns 30 brands, like Ritz-Carlton at one end of the spectrum and Fairfield at the other end of the spectrum. Huge, huge companies with hundreds of thousands of employees, and they're now requiring their employees to be trained on this. Our research shows that hotel managers whose hotels receive training, 84% said their associates' awareness of child trafficking increased within the last 3 years, as opposed to only 16% of managers who reported that their managers had increased their knowledge, awareness of child trafficking. Most managers who worked in hotels that received training also reported they were aware of their state laws on child trafficking as opposed to those who worked in hotels that hadn't received training. It took a long time to get the code embraced by the travel industry. When we first started out, when I spoke to a group of people who didn't work in the travel industry and talked about our code and talked about the issue and talked about trying to get the industry to come on board, the automatic response by most of you probably would have been, well, of course a company would sign this. Of course they'll implement this. And that was the feedback we automatically got. Universally, when we spoke to a travel industry crowd, the response was, well, of course we're not going to sign this. What does this have to do with us? This is why would we even talk about this? The reasons for the resistance were, for example, a mistaken belief that child exploitation does not have anything to do with hotels, although we now have research that shows that belies that belief. In a study in New York City, 45%, a survey of youth, sexually exploited youth, 45% reported their exploitation had happened at a hotel. In a broader study of youth, including everybody under 24 years old, showed that over 50% were exploited in hotels. It is the location. It is the location where exploitation takes place. And there was also initial resistance because the industry didn't realize they had an overlap and an understandable reluctance to acknowledge it was happening in their industry. So they didn't really want to talk about it. But many large companies also have thousands of employees who want to see their industry and their company do the right thing. We talked to many people who worked on the front lines and saw something and knew something but didn't know what they were supposed to do. So we slowly made progress, and our goal was to make the code into an industry standard in the US, and we have largely succeeded, as I said. The American Hotel and Lodging Association, which is the trade association in the hotel industry, uses our content for its online training program. Travel management companies are supporting ECPAT to develop a new training program for that industry. And that's another segment in the industry which will ensure that the message of responsible travel spreads beyond the travel industry. Because what travel management companies do is act as kind of a travel agent for major corporations. So a corporation like Apple will hire a travel management company to manage all of their company's travel. And once we start having our travel management companies talking to their people about this issue, we will be spreading it further and further. I want to point out that Delta Airlines and American Airlines have also signed our code of conduct, and I just want to end with one anecdote about what all of this means. Recently, maybe some of you saw it in the news, an American Airlines ticket agent had two young girls come to her desk to check in for a flight. They had 2 one-way tickets from Sacramento to New York. When she spoke, they didn't have any ID, and she was going to just turn them away as she would normally do, but she spoke to them a little bit. They didn't know they only had one-way tickets, and they didn't know the last name of the person who had bought the tickets. So she called her supervisor, they called law enforcement. It turned out these 2 girls had met a guy online who said that they were beautiful and that if he bought them tickets, would they come to New York and he would put them in the modeling industry and they would make a lot of money. Every red flag for human trafficking is in that story. But thankfully, they met up with a woman who was trained and aware and on her toes, and actually 2 kids just like that, protected from sexual exploitation. So I present this as a model for progress, because it actually is a huge amount of progress, and a model to engage the private sector, which I think we all have to do, and a model for how countries can continue to prevent sexual violence against children in our world. Thank you.
Thank you so much. And as we all know, you were just mentioning the numbers, so if we think about how huge the target audience for us is, both through the 290 million jobs in that particular industry. So investing in prevention, it's incredibly important. I'm also proud to say that also Childhood in Brazil has over 10 years experience working with Atlantica hotels. Yeah. And I think there the great example is the leadership of the company, how the companies engage their employees in being part of solution. And right now, I know that there is a joint project with ECPAT and Childhood in Sweden on having a joint travel campaign. So I think looking at what are the solutions and how to scale them up is really critical, and learning from what works. With that, someone who has really managed to go to scale when it comes to prevention of child sexual abuse, Lyndon, and a partner of Childhood.
Thank you, Joanna, and thank you, Carol, for that great example. My name is Lyndon Haviland, and I am a 30-year veteran of global health, public health, and global advocacy. Most recently, I served for 2 years as the CEO of Darkness to Light. Darkness to Light is a small organization based in Charleston, South Carolina, and we came to the prevention of childhood sexual abuse through a tragedy. And I think that's the most interesting thing I can say, is that every time there's a tragedy, it opens a window for a better conversation and a more important conversation about how we are challenged to end violence against children. Darkness to Light does one thing and one thing only. It trains adults to realize that it is an adult responsibility to end childhood sexual abuse. When we look across the nation, so Darkness to Light works in all 50 states, and we've worked in 17 countries around the world. And we do a training called Stewards of Children. The training is available both in person and online in Spanish, in Swahili. We've also translated it into Hindu. And what we have found is it does really an important thing. It teaches people to have a language, to be able to recognize the signs, to be able to talk appropriately with one another, and knowing how to respond. There is a great deal, as Dr. Finkelhor pointed out, there's a wide variety of programs around the nation and around the world that attempt to teach people how to recognize the signs of childhood sexual abuse. Some of them are as simple as a 3-fold brochure because they're required by law. That, we know, does not change someone's attitude, it doesn't change their knowledge base, and it doesn't change their behavior and make them do, as Carol pointed out, willing to act on their knowledge, as well as to have some type of vocabulary to understand what it is they're seeing. My specialty is actually in social and behavior change communication, which really is about looking at the whole environment in which social change must occur. It allows you to say, to actually solve these social programs, we need a complex ecological model that looks at programs like the Code, programs like the Convention, initiatives like the SDGs, and the MDGs. The thing that I find most astonishing that most Americans don't understand about the Sustainable Development Goals, if we think about the Millennium Development Goals, that was, as Andrew pointed out, that was really about the basics. Move children out of extreme poverty, achieve basic literacy, kind of achieve basic nutrition. The Sustainable Development Goals do not apply solely to developing economies. They apply to the United States as well. And it actually challenges us to think, how will we actually solve a complex social program? So we know that if we want to end violence against children, we need comprehensive legislation. We need committed and sustained enforcement. We need non-fragmented data. We need to actually address the systematic drivers of sexual abuse. We need to address poverty. I'm going to say that again, just in case you missed that. We need to address poverty, because what puts children at risk for many forms of abuse and neglect in this country are the systematic drivers and institutional policies that mean that we do not have a social safety net that actually protects children. I think it is also remarkable that the United States has not signed off on the Convention to protect children. When you look at how we do in terms of the rankings of child development, we should be ashamed of ourselves. Our children deserve better. When I started working on childhood sexual abuse, people told me, one, it's a problem that's as old as the hills, it can't be changed. After I stopped wanting my forehead to blow off, I said, our children deserve better, and we can do better. And Darkness to Light demonstrates that with evidence-informed work, we can change people's attitudes, and we can teach them how to respond and how to protect children. I think that the final thing that I'll say is that we believe very strongly in the tipping point, this idea that if 5% of the adult population in any country or any community actually believe that child sex abuse occurs, understand that it's not a problem of poor people, that it occurs in every community, every socioeconomic strata, and frankly, the richer you are and the more educated you are, the more likely you are to deny it. When we have 5% of the people willing to talk about this, we think we can change the world. Delaware, the state of Delaware, will probably in the next 6 months become the first state in the nation to train 5% of all adults. That means 5%. That means all of their National Guard, all of their law enforcement, their social workers, their nurses, their teachers. And where does pushback come from when Delaware wanted to pass a law to require this? It came from homeschoolers who said, "Don't you tell me how to talk to my children." So I just want to say it's possible. Prevention is possible. We know that it works and that it's an adult responsibility. Children are vulnerable, and it is not their responsibility to prevent child sexual abuse. Thank you.
Wow, this was a call to action for us. And as we started the day saying that, well, in New York, if you can make it here, you can make it anywhere. So it's really a call to action for us to do something. And I think this whole session is about, or this particular panel about how can we bring this global agenda and how can we use it to ensure that we can also scale up our investment in better research, in implementation, in creating a system, precisely like you phrased it, Lyndon, to have an ecosystem to address this problem. And I think investment in prevention and education and raising awareness is definitely the first step. We only have really time for one question if someone feels like they absolutely need to ask one. Excuse me. Could you please use the mic? Yeah.
Thank you. I'm so sorry.
Okay, sorry. I'm Dr. Arlene Goldsmith, Executive Director of New Alternatives for Children, which is an agency for medically complex and behaviorally challenged children growing up in New York City. We do with a child welfare agency. And I've been waiting, it's 3 o'clock, I've been waiting to hear 3 words. Poverty, number 1, right, which is the first time it's been mentioned. Disability, which is number 2. And prevention, which is really number 3. So I wanted to mention something that I think is really key, that when we're talking about brain development and what's happening with our children, we have to really look at how our children are growing up and what is going on in the environment for our kids. There is just no question about it. You talk about exercise. How many of our children can go outside in New York City and have exercise? How many of our kids live in a neighborhood where they can go to a gym or where they can do the kinds of things that really help them to grow and develop? We're doing mindfulness training, we're doing yoga, we're doing all those kinds of things that we're talking about for all of our kids, many of whom have grown up in hospitals, many of whom actually have made tremendous success. Just to let you know, the first 10 children that we took out of New York Foundling Hospital 35 years ago are now 3 of those kids in wheelchairs, have master's degrees, have jobs, have children. So prevention really works, working with families really works, and I think this was very good. Professor, I think it was very important that you talked first about disability, because 13% of children with disability, it's a higher risk of abuse and neglect for children with disabilities than in the population, the general population, and I see that every day. So thank you very much. Sorry it took so long.
No. So first, I want to say thank you, and I want to highlight 2 programs very quickly here in New York City. As chair of the Dean's Advisory Council for the CUNY School of Public Health, I work very closely with the Health Department and with the Department of Parks. And so Commissioner Silver and Commissioner Bassett both understand that access to green space is one of the key issues in mental health. And so the CUNY School of Public Health is working with the Department of Parks to evaluate what's called the Community Parks Initiative. When Commissioner Silver came to New York City, he did a survey of parks, and he said to his staff, I need to know, we knew what the parks were supposed to do in the last century, and we knew who the parks were for in the last century. But now, let's talk about this century. How do we make sure that every New Yorker, regardless of their zip code, has access to green space that they can use 12 months of year, and that those parks should be disability-friendly, and they should be owned by the community. So they undertook this huge process of community meetings where the community was engaged in a conversation about what did the parks mean to your mental health and your physical health, and how can we redesign them together. They have rolled out multi-millions of dollars into parks where it wasn't a park by my standard, it was like a terrible little parking lot. And CUNY is actually evaluating it, looking at how this is actually improving the health and well-being of the communities that surround them. And so I couldn't agree with you more that access to parks, access to green space, and mental health and physical well-being are critical. The last thing I want to do say is we know that the data in the United States on disability and sexual abuse is terrible. But what I can say is that we are pretty clear that a review of the data says a child with a disability is at probably double the risk, and that a child with multiple disabilities is at extreme risk. And until we have a vocabulary and we have a national plan that says children with disability as well as able-bodied children should be prevented from having the threat of child sex abuse, we're failing.
Thank you so much. And thank you to the panel. And we have used 2 extra minutes from the other panel, so we have to move on.